And our second segment this morning with Dr. Kavanagh. He's a retired physician and founder of Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
How are you today?
Doing really good, sir. Thank you.
How was your Thanksgiving?
Well, it was a little bit lonely, but stuffed. I had more food than you can imagine.
Good. That's good. I'm sorry it was lonely, but we do what we have to do. Now, nothing is perfect and nothing goes perfectly. Anytime you have any project, there will be bumps in the road. And the first thing I'd like to talk to you about this morning is the one that AstraZeneca Oxford study has run into.
Well, this was essentially a mistake that they made during their clinical trial. They had 2,700 individuals out of tens of thousands that received a lower dosage of the vaccine during the initial injection. Remember, this is 2 injections for this vaccine. And what happened is those individuals had a 90% efficacy rate. The other individuals that had the higher dose had a 70% efficacy rate. Well, the group that had the smaller dosage were a small number, given the dosage by mistake, and no one can figure out why the group that had the smaller dosage did much better than the group with a higher dosage. And this is just the initial injection. The second injection, they both had the same dosage. And so because of that, AstraZeneca is kind of in a quandary of what to do. So is the NIH, and they may put off their vaccine approval process until they get more individuals in that first dosage group that has the least vaccine or the less amount of vaccine, and to see for sure what the results are, because it may look like that might be a better way to give the vaccine, and they have no idea of how it happened or why the lower dosage is doing better than the bigger dosage. So that, although is disappointing, it's not, disastrous where the vaccine doesn't work or is causing abnormal problems. This is actually where it's causing less problems and more efficacy, and they have to figure out why.
But from a research standpoint, are they having to start from the beginning?
I don't think so, no. I think the individuals that got the proper dosage will still be in the trial going forward, and you'll have more long-term quality data and safety data on that group. So I really am actually still encouraged with the vaccine. And of course, this is the vaccine that's for the world. It just requires refrigeration. It can keep for a month once the vials are broken open. And so it really is a vaccine that I would like to see get on the market and get distributed.
The Supreme Court ruled regarding religious groups in a dispute, and there was also a ruling, federal court ruled regarding religious schools in Kentucky. Talk about that.
Well, to me, and I'll be honest with you, Jack, I'm not all that surprised, because one of the things our group is very concerned about in the control of infectious disease is that certain facilities or certain entities are given different rules. And of course, the bug doesn't care. And all of the hype that you're seeing around this, well, the government can't regulate churches, etc., that is not what the ruling stated. The ruling said you have to do everybody equally. And that's very important. For example, during the 1918 Spanish flu outbreak, the Catholic Church closed down their services. They closed them down for at least 5 weeks. And they promoted masks. So this isn't so much a ruling on governmental power as it so much is that you've got to come up with a coherent, standardized policy that is applicable everywhere. And we've talked about this, a national type of a policy. And remember, in New York City, for example, they have a test positivity rate of 3%. Indoor dining, indoor bars were open to 10 p.m., yet they were closing churches. Drove people crazy there. They're going, what's going on? Well, I have to ask that too. What's going on? Kentucky, you had a whole segment on athletic events and sporting events that were still going on, yet we were closing down certain entities. And again, there's a lot of public discussion on that. So this could actually be good, because the remedy, I don't think, should be opening up the schools or the religious schools. The remedy should be closing down other high-risk venues so everything is equal. And you can do that by coming up with recommendations that are based on the characteristics of the viral spread and what needs to get done to stop it. You don't even have to mention the type of facility, just that this needs to be done with this type of crowd conditions or congregation of people. So that, I think, can be easily done. It should be done because a lot of work needs to be performed in order to get social distancing safe, to have mask enforcement, and ventilation. Ventilation is huge because this virus is airborne. And remember, with loud speaking or yelling or shouting, this virus can spread further than 6 feet, and aerosolization of the virus can defeat a cotton mask. So the cotton mask helps, but it's not 100% protective.
We talked about it with others on the show. I'm not sure I've talked to you about this, but the reference that you made to sporting events, it didn't make any sense to me that we weren't allowed to have more than 10 people in our homes for Thanksgiving, but we could have 3,000 in Rupp Arena for a basketball game. Well, it was pointed out, and I understand that Rupp Arena is much bigger, and you can have more space and distance between people with 3,000 in Rupp than you can with 10 in your dining room. But to me, it was sending a kind of a negative message, like we don't really have our priorities straight. Basketball is more important than family. I don't know, but I didn't like the message that it sent.
Well, I think you're right. And it's not just when you sit in the seat. You've got to get in and out of the seat in the hallways. You congregate in the bathrooms. And during sporting events, there is a lot of screaming, shouting, and cheering, which aerosolizes the virus, and that can then float in the air, spread around, get in the HEMVAC system, spread around the entire arena. And so it really is problematic, that type of event. And I think that in all retail stores, in churches and schools, etc., they really need to consider putting in UV lighting, upgrading their ventilation system to increase air exchanges. And Jack, I'll tell you, there's a whole science behind this. I mean, it's not like you pull this stuff, out of thin air. There is a whole science on healthy buildings and building safeties and standards set up, and they need to be enforced and upgraded, especially during a pandemic.
And you have to wait a few days before you see the results, but it'll be interesting with all the people that went on and had big family gatherings, and apparently there were lots of them, and the athletic events and what have you. In a few days, it'll be interesting to see what the numbers do.
Well, if it's like past history, they're going to go up. I mean, we saw this on every one of our holidays that we have had during the last year. Canada was doing great till they had their Thanksgiving, and then they had a huge outbreak. And so now we're going to just repeat the same thing over again. And of course, you can get mad at the public for not following advice, but when you look at the advice that's given and how confusing it is, you really can't totally blame them because they get confused. They go, well, what the heck's going on here? And so that is very frustrating. And that's one of the reasons why when I looked at the court decision, if you read into their reasoning and what they said, it really wasn't bad. It's come up with a coherent, standardized national plan that's not influenced by economics or influenced by politics. So all of that needs to get done. And so I think it may be a good thing in the long run, but it certainly does send a message that a lot of the news media picked up. Well, this is church versus state. No, it's not. 1918 pandemic, the church was hand in hand with the state in trying to control it. And we need to get there during this pandemic also. They'd be a very valuable resource to get on board.
And another of the many things you just mentioned, the confusing rules and regulations, not only in Kentucky, but all over. The bars and restaurants in New York City can remain open until 10 o'clock. Well, if they can remain open until 10 o'clock, why can't they stay open until 1 o'clock? Or, inconsistency, I guess, is what I'm getting at.
I agree, yes.
Yeah, in-person school is out, but going to a bar is okay. That's the kind of inconsistency that I think confuses people and makes them want to throw up their hands.
Well, and I know, but I think that while we're in this bad surge, we need to have the remedy not opening up the schools, but closing the bars. We need to be consistent. You can still have outdoor activities, But bars and restaurants have been shown epidemiologically to be the most problematic. And one of the reasons is you oftentimes have loud music, you have loud vocalization, and you can't wear a mask while you're eating and drinking. I mean, that's the big problem there. Even more problematic than, for example, churches, because you can wear a mask in church even while you're singing. Not that that's a low risk activity, but when you look at the two, it doesn't make sense to do one and not the other.
Right, I agree. All right, we've got some calls coming in. Here's a text from our auto text service text line. Did you see the new peer-reviewed study that hydro and erythro is effective treatment article in Washington Examiner today? That's from Dan.
I had not. I'm not sure what hydro and erythro, though, are. I'll be honest with you. That's obviously an abbreviation, so I can't help there.
I was hoping that you did, because I certainly didn't.
No, I didn't. That's one of the problems with the show. Everything comes out so fast. It can come out that morning. I actually cram trying to look for those articles that are coming out, and I don't always get them. So that may be something we can address on Monday. But I would warn everybody to be a little bit careful. Remember what happened with the hydroxychloroquine debacle. You really do need to wait for randomized controlled trials before you switch to another type of a medication or treatment, especially when you have effective treatments that you can choose from.
The folks on hold here. Mary, good morning. You're on with Dr. K.
Good morning. I have heard, and then I heard it again, that there's something about being exposed for 15 minutes, and if it's not that much, you're okay. And Coach Stoops said something like that on the news just yesterday, and I'm just wondering, is there any truth to that? That if it's not any longer than 15 minutes, you're probably okay, and after that, you could be exposed?
Well, the longer a time period that you're exposed to the virus, the greater the chances are of you getting the virus. So it's not all or none. 15 minutes is used as the cutoff of when they allocate case tracking resources. That doesn't mean you're safe at 14 minutes or 10 minutes. I mean, you can rub up against and get exposed to someone shedding the coronavirus for 30 seconds and you can get it. I mean, I remember when I went out of Phoenix and went up to a person in a parking lot that was inside a little security window. They opened up the window, coughed. They obviously had the flu. I was exposed for 20 seconds. I got the flu. And the flu's not as contagious as the coronavirus. So it all depends upon viral load and viral exposure. It's not all or none. Those rules are more for community tracking, trying to get down the case rate in the community so the epidemic will eventually burn out, than it is to keep individuals safe. There's two things. One is community health. One is individual health. If you rub up against someone with the coronavirus, that's not safe. It's not safe even if you're wearing a mask, because remember, there's a chance it could come in through the eyes too. People in America are really not that much tuned into eye protection, but that's something that, as you know, I think, especially during the height of a pandemic and when you go indoors, that you should be wearing also.
Okay, thank you very much. Somebody should tell Stoops that, because he was thinking his encounter with the Alabama coach that wound up having testing positive, that he was okay because it was just a quick encounter.
Yeah. Okay, thanks, Mary. Another line, and Bruce. Good morning, Bruce.
Yes, I think inconsistency and clarification of the rules is one aspect. It was probably number one, but I think it's dropped to number two so far as compliance. And at number one is now hypocrisy of politicians. There are so many instances of it, and people are scratching their heads like maybe there really isn't anything to this, but politicians aren't taking their precautions that they claim that we should. And I think that's it. I think it's hypocrisy is number one, and clarification of rules is number two insofar as fighting this virus.
Bruce, I appreciate it. What do you say, Doc?
Well, that is also a problem, yes. We've seen this with the governor of California being called out on an event that was, well, maybe legally complied, but really wasn't wise on doing, is having a gathering at a restaurant, very large gathering. You've also seen this with Governor Cuomo, who was recently called out, and he then reversed stances. And so there is some hypocrisy, but I don't really think that mentally in our politicians and leaders are saying, well, I'm going to tell them to do this, and I'm going to then break the rules and do something else. You need to remember they're people too. They're under tremendous stress, tremendous psychological stress, and they're going to make mistakes also and have lapses. So I really think you need to not say, oh, they're evil or ill thinking and, are doing harm to society, but rather that, hey, they're people too. They need support. They need correction. And we understand that they may also break the rules, but when they do, they need to be called out and held responsible. So I am disappointed. The rulers need to follow the advice that they're given because, believe me, the virus doesn't care whether it's a Democrat, whether it's a Republican, whether it's a big box store, whether it's a church, whether it's a bar, whether it's a sporting event. If people congregate together that aren't within your family unit, you have a chance of spreading this virus. And during this large surge, this is extremely important to try not to do that.
Dan has written us back. He's the one that referred to a study, hydroxychloroquine and erythromycin was what he was talking about. Said low-dose hydroxychloroquine combined with zinc and however you pronounce that, mycin, was an effective therapeutic approach against COVID-19. What's the second one there? Azithromycin?
Azithromycin, yeah, I would be very hesitant to do that type of a regime because, as you know, hydroxychloroquine can prolong the heart's QT interval, which can cause dangerous arrhythmias. Most people, you're taking it for malaria, that's not a problem. However, COVID-19 can cause a myocarditis of the heart. It can do that commonly, 15% of asymptomatic individuals or mildly symptomatic individuals that can happen with. And that makes it more toxic. And guess what? Azithromycin does the same thing. It prolongs the QT interval. So I think this is just a toxic mix. You have at least 8 randomized controlled trials now that have not been able to demonstrate a benefit. And there are also laboratory studies in animals. For example, the initial one, or one of the initial ones, used monkey kidney cells. They showed blockage of 99% of the viruses by hydroxychloroquine, but it was in monkey cells. It uses a different enzyme than human lung cells. Repeat it in human lung cells, it didn't work. So hydroxychloroquine, there's so much evidence against it, I think you'd be better looking for another alternative or another way of keeping yourself safe.
Okay, another text says, is it safe to be around a person who tested positive after 14 days of quarantine, and should their home be sanitized?
The CDC gives a yes to that. For me, I would certainly want to sanitize the home. If you're 14 days post-symptom onset and a very mild disease, it's okay. If it's a severe disease, it goes up to 22 days. So I will say that it's safe, but with some qualifications on that. The severity of the illness is important. And certainly the idea of during the pandemic of wiping down a house is not a bad thing to do. So, it would be good to do anyways. So I know that that's not a direct answer, but hope that helps.
Err on the side of caution, in other words.
Caution, yes.
Lane says, thank you for this guest. I appreciate talking about consistency. Keeping UK basketball happening at Rupp while asking for shutdowns is inconsistent. And that is from Lane. What else we need to talk about here? We've covered quite a bit of territory. Anything on your list here that you want to hit before we run out of time?
Well, the one I think is wearing masks. There's been a lot of misinformation that masks are not effective. They are. Remember, they're more effective for the person not wearing the mask than the person that wears them because it prevents an asymptomatic carrier from spreading the virus. There is a new study out of Kansas where the governor mandated that everybody wear masks, but gave counties the ability to exempt or opt out. Well, 81 counties opted out, 24 counties kept the mandate. And over time, there was a 6% decrease in coronavirus cases in the counties with the mandate, 100% increase in those counties that opted out. And of course, this is a study that looks at both the wearer and the non-wearer. It's looking at the community prevalence of COVID-19. There was also another study out of Denmark, and this looked at almost 5,000 individuals, and they gave half of them masks, half of them not wearing masks, and they followed whether or not the mask wearer or the non-mask wearer got COVID-19. Well, it turned out there was only a 14% reduction in those that wore the mask. And so you'll say, well, why is that? Well, two reasons. One, remember, protects others more than protects you, but also some people, when they wear the mask, they go crazy. They start entering into a risky behavior mode. And if you do that, you defeat the purpose of a mask. The idea there is you have to go to the store, wear a mask. It's better than going to the store without a mask. But if you're going to now go to 10 stores, it defeats the purpose of the mask. So you don't want to have risky behavior when you're wearing a mask because it's not 100% protective.
What about these new masks that I'm seeing popping up that also have eye protection built into them?
Well, I think that is good. I think eye protection or goggles, wearing those should be done, especially during the height of a pandemic if you're going into an indoor area. You certainly see goggles in Southeast Asia. Dr. Fauci has mentioned that. Consumer Reports has mentioned about the importance of goggles. If you have to choose one, goggles or mask, choose a mask. A mask is probably twice as protective as goggles, but both give you an added layer of protection. Kind of like being in the Army or being in a foxhole. You've got a helmet, you've got a bulletproof vest. It's good to wear both, but neither one alone will give you 100% protection.
Here's a text from our Auto Tech Service text line. Had virus in July. Can you get the virus again?
We really don't know because that comes into whether or not you have what's called memory B cells. There are multiple studies out now, 6 or 7, which show that antibody levels rapidly drop, especially if you have a mild or an asymptomatic infection. But we don't know if these memory B cells will spring up and start producing antibodies quickly. There have been a few reported cases. That's the bad news of reinfection. But the good news is there's only been a few reported cases.
Thank you very much. We'll talk to you on Monday. Have a great week.